Good evening. My name is Bob Nolan. I'm the Chair of the Community Relations Committee of Health and Hospitals. I hereby call this meeting to order. I want to thank everybody for joining us in person here at the board office at down in Lower Manhattan, as well as those of you who are joining us through WebEx. What I'd like to do is call for a motion to adopt the minutes of the September 14th, 2021 meeting. And I'm going to poll individual members. Mr. Jose Pagan?
Yes.
Yes. Dr. Mitchell Katz?
Yes.
Sally Hernandez Pinheiro?
Yes.
Okay. So all in favor, all the votes are in favor, so the motion is carried. Scheduled to present verbal reports today, this evening, are the following CARES: Health and Hospitals Jacoby, Health and Hospitals North Central Bronx, Health and Hospitals Sydenham, as well as Harlem and Metropolitan Hospital. Now I'm going to turn the meeting over to Dr. Katz, who will give his report as president of New York City Health and Hospitals.
Thank you so much, Mr. Nolan. I want to start by saying we were thrilled that Governor Hochul nominated Dr. Chinazo Cunningham as Commissioner of the Office of Addiction Services and Supports, otherwise known as OASIS at the state. People will know she served as the Executive Deputy Commissioner of Mental Hygiene at our sister Department of Health and Mental Hygiene. In that capacity, she sat on our board, and we're so pleased because she really understands the issues of addiction. And I think having her at the state level is really going to help us in creating responsive programs in the city for this population. The mayor placed $240 million in the capital budget for building a therapeutic housing unit at North Central Bronx to provide incarcerated patients with specialty and subspecialty services. The unit will include 120 beds and aim to be completed by 2024. It's a huge victory for the inmates because one of the hardest things is if you're in jail and need frequent specialty care, such as chemotherapy for cancer or frequent visits for congestive heart failure, that means multiple trips on the bus to the hospital, during which you'll be in a holding pen. The bus only can come once in the beginning of the day with everybody who needs hospital services and leave once, so people are spending a day in a very uncomfortable situation. That would be very difficult if you're chronically ill, and this will give us a place where we can actually treat people who have these chronic problems. It's also great for North Central Bronx because the hospital really needs some basic upgrades such as elevator modernization, new roof, and this money will be immediately felt by people who use NCB as an improvement in the appearance of the facility. This is a locked ward, so there are no security concerns that we have. We think this will be great for the people who continue to rely on NCB as their acute hospital, as well as great for the inmates. We began COVID vaccination to the 5 to 11-year-olds. The Health and Hospital T2 team did 4,449 vaccinations in 1,000 schools yesterday. So I think it's pretty amazing for a first day. We'll know more shortly. We're active giving booster shots to people who need them, whether that's because the person's in over 65 or have an underlying medical condition or have a greater exposure because of the work that they do. We're continuing our testing and support. We promote flu shots to everyone, and we remind you that October was Breast Cancer Awareness Month, and we schedule screening mammograms as well as other breast screening exams for people who need them and want them. With that, Mr. Chair, is my report.
Thank you very much, Dr. Katz. I will now hear from the 5 facilities presenting their verbal report today. Their report is brief, but it's comprehensive and it's focused And we hope to learn about what is going on at those hospitals at this meeting. And what I'm going to do is a lot, of course, as we do each meeting, 5 minutes to each one of the speakers. And we are grateful for the work that went into the preparation of them, the speakers, as well as the CEOs and staff of the various hospitals. And thank you in advance to all of our speakers for keeping to your 5-minute time and for the commitment to our system. So first up for our meeting from Jacoby Hospital is Joe Menta. Joe?
Good evening, everyone. My name is Joseph Menta, and thank you, Bob. I'm the acting chair currently for the Jacoby Community Advisory Board, and I'm happy to report that officially North Central Bronx and Jacoby have merged in February 2021, and we're now a single hospital with 2 campuses. The merge has been very successful and formalized the longstanding partnership that we have with these 2 facilities. The merge has greatly reduced duplication of efforts for physicians who are joining our organization. And over the past 12 months, Jacoby has seen patient volume return to the pre-COVID levels. The merger has facilitated a seamless transfer to patient to NCB when the Jacoby emergency room is overcrowded. More than 1,000 patients have been transferred to North Central over the past 8 months. Jacoby has also become a Joint Commission approved primary stroke center in July. They began their STMI STEMI ability to treat heart attack patients on a 24/7 basis in the new cardiac catheterization lab. COVID-19. The COVID-19 crisis had a major impact in New York and the Bronx. As a major public hospital in the Bronx, Jacoby's ongoing response to the pandemic includes the following. We treated and discharged over 1,000 COVID-19 patients. They expanded testing clinic hours, administered over 68,000 tests to date. New York City COVID-19 vaccination site delivered over 50,000 vaccine doses to date. Guidelines established for protective equipment, masks and social distancing, PPE distribution for clinical staff at the central area, enhanced cleaning protocols implemented and ongoing throughout the campus, and then Jacoby's Helping Healers Heal initiative, which has been communicating relevant information through a variety of venues, including internet, flat screen systems throughout the facility, e-blast messages from CEO and medical director, virtual town halls, and signage throughout the campus. Our infrastructure and equipment. Over the past 12 months, Jacoby's acquired several new pieces of equipment, including new operating room tables for orthopedic cases, ultrasound machines, 2 new cardiac cath machines. We're waiting to start construction on the new MRI suite. This will add a needed second MRI to better serve the community and reduce wait times. And then other priorities are renovation of the mother-baby unit into single rooms. Most are double right now without private bathrooms. We need construction to replace the nuclear medicine camera and replace one of the interventional radiology units to provide advanced stroke care from thrombectomy capable. Patient safety and satisfaction. Jacoby's direct care providers and hospital staff receive well-deserved acknowledgement and gratitude from the patients, families, and community for their hard work and dedication throughout the crisis. They appropriately were known as Jacoby Healthcare Heroes, and they continue to provide high-quality medical care and compassion during these extraordinary challenging times. Before frequent complaints raised by patients. Most frequent complaints raised include wait time in ER for relatively minor complaints and patient access to care. ER wait times have been greatly improved from improved staffing and changes to the patient flow. Currently, the average wait time for the arrival to seeing a physician is 30 minutes. And lastly, the issues impacting the community served by the facility. Access to COVID vaccine education in multiple languages has been an issue in many of the immigrant communities served by our hospital. In response, Jacoby's partnered with community-based organizations and local elected officials to provide vaccine education workshops in multiple language, including English, Spanish, and Albanian. That concludes the report for Jacoby Hospital.
Joe, thank you very much. We appreciate your presentation. Are there any questions from any of the board members to Mr. Menta of Jacoby Medical Center?
Mr. Chair, I would just like to say,
Dr.
because
Katz?
he had mentioned it, that the ability to grant patients who come to Jacoby a instant bed at NCB instead of hours and hours of wait in the Jacoby ED has been a huge plus in terms of quality of care. And it also, of course, helps then there's more room in the emergency department to take care of the next person who comes in quickly to Jacoby. So I just think this has been, such a positive change in health and hospitals. And really the model for all of our hospitals is that helping each other enables us to both fill in holes and really make sure that patients are taken care of appropriately.
All right, and thank you. And we'd like to also thank leadership, AJC leadership, for helping facilitate the merger between Jacoby and North Central Bronx. Thank you.
Thank you, Joe. You should know that I was in there in the emergency room within the last 2 weeks, and we had a doctor who was at the bedside within 10 or 15 minutes. And then we had a second doctor a short time after that. So certainly, when you say no more than 30 minutes here, that certainly is the case. And what Dr. Katz has said about the moving of patients up to NCB, it seems to be working very, very well. Are there any other questions from members of the board? Hearing none, thank you so much, Joe. We appreciate it. I wish to your board members and everybody else at Jacoby Hospital a very happy Thanksgiving. And I know you have a CARE meeting, I believe, Thursday, correct? No, Wednesday night.
Yep.
Yeah,
Yes.
Wednesday. So I'll be on that Wednesday night. Thank you so much.
Wonderful. Thank you, Mr. Nolan. Thank you.
Okay, we're going to move on then to our next speaker, representing North Central Bronx, is going to be Esme. Esme, can you hear me?
Yes, sir.
Hi, how are you this evening?
Good. Good evening, everyone. To the staff, Dr. Katz.
Good
I
evening.
just want to say that the chair for Jacoby had covered for both hospitals. So I just have the icing on the cake to say that I am so proud and delighted about all the changes what's going to take place with the budget. And I am so happy for Mr. Maschermano and Mr. Jones as working with the doctors, Dr. Zinnemann. I was at the meeting on the 3rd, and I got some very important input and positive that I am happy for everything that is working along to get new machines and for the city and whatever. I am so delighted, Dr. Katz, for working with us abreast, and I'm so happy. So that's my report. And the vaccine for the children, we're working on that in my community for North Central. So that's my part of the report.
Esme, thank you so much for your presentation. Are there any questions for Esme Satur, our liaison from North Central Bronx?
I had a question, which I think there may not be an answer to just yet, but there are $38 million energy grant to replace 7 elevators. And Dr. Katz had mentioned that a portion of the therapeutic unit capital funding was going for elevators. Is that over and above the 38 million?
Yes.
Great, thank you.
Elevators are remarkably expensive.
Yes, they are.
Hello?
Who is that?
Yes. Who would like to be heard?
This is Jackie Rowe Adams. I thought this was this is the Council of Cab.
Yes, well, it is not the Council of Cabs. This is the Community Relations Committee meeting that we're meeting. The Council of Cabs will start at 6 o'clock.
Oh,
Okay.
okay. Okay, thank
You're welcome. Since there are no other questions from North Central Bronx, we will move on to our next speaker. It's my pleasure to introduce Ms. Everett Person of Sydenham. Ms. Person?
Yes. Good
Hi,
evening,
how are you
everyone.
tonight?
I'm fine. I'm fine.
Go right ahead.
Thank you. First, I'm Everett Person once again, the chair of the Community Advisory Board at Sydenham. I would also like to acknowledge Dr. Mary McCord, who's our interim medical director, and Tracy Bowes, who's our deputy director. I like to talk somewhat in my 5 minutes about COVID And I emphasize that because Dr. Ted Long, who was our not guest speaker, our main speaker at our annual public meeting, and he emphasized the quantity and number of vaccinations and tests that we had done at Sydenham by our staff and our management staff as well. One of the most interesting things about it that I discovered that there were many people who received the tests and the vaccines that were not from New York City. So that's a way of just putting our name out there in terms of the Sydenham and H&H is what we do, not for only people in the city of New York, but we welcome those outside. So they did come, and we were proud of that period of time. Gotham Health Center system, Sydenham, directly supported testing and vaccination efforts throughout the worst of the pandemic. Sydenham oversaw 4 COVID testing tents and vaccination tents throughout the period. In total, Sydenham provided COVID tests to 156,836 community members and staff. We also administered a total of 13,398 COVID vaccinations. We are grateful for having had the opportunity to provide that level of service. Currently, the COVID testing vaccination support to the Sydenham community continues through the efforts of NYCH Test and Trace. As we transition towards a state of normalcy, Sydenham continues to work on securing proper staffing, equipment, and PPE needs, personal property equipment. Sydenham maintains its readiness in the event of any future potential surge. However, we look forward towards the future and our responsibilities of providing low-cost, high-quality care to the patients of our communities. As we enter the flu season, this is important, and I must emphasize, it is important we also have prioritized our focus on patient and community education as it pertains to the importance of flu vaccination. COVID is here to stay, and we must prepare on all fronts to combat infection and disease. In addition to continuing to offer COVID vaccination, our goal must also be to maximize community flu vaccination rates in an effort to prevent infection with COVID and flu. The combination can have devastating effects on a large portion of our patients within our communities. Lastly, though, in terms of COVID, we want to emphasize the need to have our city wagon out front of our facility in terms of boosters. We are ready for boosters. So whether it's on the city wagon or it's in our facility on 18th Street. So we look forward to the boosters for our communities. Infrastructure, real quick, in an effort to modernize Sydenham's facilities, the institution is supporting various upgrades at the Sydenham and its facilities. We are also in the process of securing funding to install a retinal screening camera. This will be vital in the role of evaluating patients for retinal changes of the eye as a result of specific chronic diseases. The ability to do this will allow for easier access to evaluation for patients and ultimately earlier intervention to prevent progression of damage and loss of vision. Patient safety satisfaction? Well, we continue to focus our efforts and maximize our strategies towards 2 vital committees, the risk management and 2, the patient experience. The Patient Experience Committee reviews and interprets the Press-Ghani and site-specific feedback in order to develop strategies to systematically enhance patient experiences at our facilities through proactive process and corrective action plans. Frequent complaints, yes, we have them. Patients provided feedback that they would call the main Sydenham line and no one would answer the call. As this was identified as a major point of dissatisfaction for patients, Sydenham leadership addressed this by identifying and training a staff member to answer this line and provide patients with immediate support. So currently, this is my report. And the last issue would be, and this comes from our community, and that's several for years, patients and our community members who are not patients do not understand why there are not more subspecialties at Sydenham Health Center. This concludes my report, and I thank you very much.
Thank you very much, Mr. Person. I would like to mention to you that the boosters are available now, and they have been available for a couple of weeks, and you should speak with the executive director at Sydenham about getting that booster, and certainly should all the members of the CAB be in direct phone contact with your executive director so that you can follow up and get your boosters as soon as possible.
Thank you, Mr. Nolan.
Okay, and then I'd like to move on to the concern that you raised about the inability to reach the clinic, the very difficult ability to get to the clinic. Have you been in touch, has your board been in touch with the MTA about rearranging some of the bus routes in Manhattan so that you're able to get, the larger amount of your population to Sydenham?
That's a good thought, and the answer is no, we have not done that, but that sounds like something we should do.
Yeah, I think that, the MTA is open to listening to everybody about the change in bus routes that would accommodate people, especially coming to a facility like Sydenham. People need to get to Sydenham more than they need to get to their local barber shop. So
Right.
certainly the medical needs of getting to Sydenham are critical. And if you find that the bus routes are set up in such a way that they're not convenient and getting from one area to the hospital, then getting in touch with the MTA certainly would be the best thing to do to find out if you can get, and you need to be very forceful about putting together your own plan. So you might want to sit down and talk about that at your next meeting and talk about contacting the MTA. And since it is a state agency, you might want to involve your state senator and your state assembly member.
Thank you again. That'll be on top of our agenda.
Okay? Very good.
Thank you.
Thank you so much. And as for the issue of specialties at Sydenham Health Center, you raised that issue. Dr. Katz is here. He's heard what you've had to say, and we appreciate you raising that issue.
Thank you.
Thank you. Are there any questions from any of our board members for Mr. Person? Seeing none, I want to thank you, Mr. Person, to wish you a happy Thanksgiving to you and all the board members at Sydenham, and thank you for the work that you do.
Thank you.
Okay, we're going to move on now to our Health and Hospitals facility in Harlem. And it's my pleasure to introduce Ms. Karen Dixon. Ms. Dixon?
Good evening.
Hi, how are
Hi.
you this evening?
Good, thank you, Mr. Nolan. Good evening, everyone. My name is Karen Dixon. I'm the chairperson of New York City Health and Hospital Harlem Community Advisory Board. At this time, I'd like to thank Dr. Mitchell Katz, the members of the Board of Directors, Mr. Nolan and the CRC, as well as the Council of CAB. It's been my pleasure this past year to serve as a member of the council. I would also like to thank Dr. Way, our interim CEO. We thank you all for sharing him with us at Harlem, as well as thank our beloved Ms. Ebony Carrington, who left us a few months ago. The hospital continues to do an excellent job during the pandemic of always being transparent, as well as keeping the community informed about COVID, the vaccine, and the condition of the hospital. My report is going to cover 4 to 5 main areas, the first of which is COVID-19. We have been in this pandemic for well over 18 months now. And in June of last year, the hospital used its incident management team to convene a planning team, which looked at lessons that were learned from the first wave and developed hospital-wide and departmental plans, which could aid the hospital in a further response. Because if you remember that time last year, we were also fearful of.
Tune in tonight at 6:31 after CBS Studios at 6 o'clock. Coming up next here at 5, they were dressed as police officers and even had a badge.
I'm sorry, I don't know. I'm sorry, can you guys hear me now?
We can, Ms. Dixon.
Okay, sorry about that. I don't know what just happened.
Okay,
So the
no
hospital was
problem.
concerned and was preparing itself for a second wave. And so the incident management team really wanted to make sure that staff in the hospital was prepared for what might come. And so in December of 2020, they formed what is called our Incident Command Center. And some of the health and hospital folks have experienced it that are not part of the Harlem community, in that it created the vaccine pod. Members from the community as well as staff utilized the vaccine pod. It was also used to manage new staff, onboarding them to help with any increased workload. And it facilitated transfers both internally and externally from the hospital. And so the hospital transferred out 37 patients and received 9 from other hospitals. Towards the end of December, the vaccine became available, and when the pod became live, members of the staff started to get vaccinated, and a lot of activity started to happen. The vaccine pod, by the way, is phenomenal. It has grown over the past year, with it moving from one location to another to meet the growing need and utilization in the community. In addition to that, we've had some infrastructure work done. We've seen that there's been secured funding for multiple pieces of equipment. So there was type 1 EES project in which the ceiling tiles were replaced, lighting was replaced. And I noticed that immediately walking into the hospital is a lot brighter. It's a lot engaging. It feels good. It feels like you're in a professional space. And so we are able to see the immediate outcomes of all of the work that was done related to equipment. We've also decanted the Women's Pavilion for demolition, and we've moved multiple departments out of that building into other locations. Regarding patient satisfaction, one of the things that we see that's an ongoing issue is that there are frequent complaints that are raised by patients and possibly residents that are tied to how we are communicating and care coordination. And the two go hand in hand. And so the hospital has been very committed to ensuring that they address these issues immediately and expediently. And so one of the corrective measures that's been put in place is that the nurse leader during rounds will assess if there are any complaints and address them so that a corrective action can be implemented while the patient is still receiving care indefinitely before they leave us. The community continues to be affected by a series of health issues that includes hypertension and high blood pressure, smoking, diabetes, lung disease, whether asthma or tuberculosis, alcohol and drug use, obesity, HIV and STDs, cardiovascular, mental illness, and psychiatric disorders, cancers, and the newest one is the fear of losing disease. Our CAB have also been working with the hospital through our various committees. Our vacancy committee has also set up to make sure we've watched the number of staffing vacancies be filled over the past year, so that's a good thing for the hospital. The final word is that the project participated in a mural. The hospital participated in a mural project for arts in medicine. And we'd like to thank the Lori M. Tisch Foundation for the Illuminations Fund. There's a beautiful mural in the pediatrics department when you first step off of the elevators. And it's such a different space for our young people who have to be hospitalized for various treatments. I'd like to thank you all, and my apologies for the previous disruption.
Thank you very much, Ms. Dixon. Could you expand just briefly on the issue of communication and the communication problems that you said exist at Harlem Hospital?
Right. So in one instance, we had there was a daughter who reported that her father was supposed to have one particular thing done, and the communication between the change of shift in staff, where the nurse that was outgoing nurse was aware, but the incoming nurse did not communicate it as expediently as needed. And so as they're doing their rounds, they're able to look at that issue and then go back and address it and ensure that everybody is on the same page. Another example, I'm sorry.
Okay, thank you so much. Are there any questions from any of the board members for Ms. Dixon? Hearing none, thank you so much, Ms. Dixon. Please, happy Thanksgiving to you and the members of the board at Harlem Hospital. And finally, I'm going to call upon Mr. William Smith, who is the chair of the advisory board, the CAB at Metropolitan Hospital. Mr. Smith, are you on the call?
Yes, I'm here. Can you hear me?
Go right ahead. I can hear you clearly. Go right ahead and begin your presentation.
All right. Thank you so much, everyone, for this opportunity. So it's a pleasure to deliver this report this evening. Metropolitan is very proud of the way that it's been able to respond to the COVID-19 pandemic. Recently, while almost a month ago, but around October 7th, we had no COVID-19 positive cases. So that's just a testament to the hard work of our staff and in the work that they've dedicated to ensuring that our vaccination center is robust. And I just want to highlight our staff and their efforts to ensure that our community gets all of the information that they need when they're making their vaccination decisions. So we remain vigilant against additional outbreaks, and we look forward to working with our community partners as we work to rev up expanding vaccination in our communities. As you know, in East Harlem, and as I'm sure in all of our other CAB and respective communities, it's very hard talking to the community about the importance of the vaccine. So I just want to thank HHC and the Metropolitan staff for their work. In terms of infrastructure and equipment, the hospital is in dire need of a new emergency room, given the growing needs of the East Harlem community, the extensive numbers of people who have moved into the community. It's imperative that the hospital receive a new emergency room so that way it can meet the capacity needs of the community and be able to effectively treat our patients in an effective and efficient way. Additional capital needs for the hospital include the FEMA flood wall. Those are capital projects that are underway, as the infusion center, as well as a new Pride Center. So we very much look forward to seeing those projects come to a conclusion on time and enhancing our service delivery for the broader community of Metropolitan. In terms of patient safety and satisfaction, we continue to be recognized for excellence in the in the areas of stroke, heart failure, women's health, breast cancer, patient safety, and most important, LGBTQ health, which is very important given the fact that we have our new Pride Center under construction. So I'm sure we'll be receiving, amongst other hospitals, but we will be receiving increased volumes from the different members of the LGBTQ community with upon the completion of our Pride Center. Also, in regards to the hospital, has been dealing with a lot extensive community challenges in terms of the pickup of loitering and unfortunately some homeless members of the community who may face mental health and substance issues. So our outreach staff as well as the mental health staff are working with our community partners and in outreaching into the community so that way our residents know that the hospital is there to help and that there is somewhere for them to go for some type of medical assistance or potential solution. Frequent complaints by patients and residents, which I'm sure is a constant theme, is the inability of access to parking around the hospital. That's something we'd like to see HHC explore with the community board and other city agencies to see how we could examine ways to address that issue. Because it's really important. We have many patients who have limited mobility and they rely on street parking, so that's a key issue that we'd like to see examined further. And just to close, in terms of the issues impacting the communities we serve, we share the concerns with our fellow residents in regards to the oversaturation of opioid treatment centers. It's an ongoing discussion in our community. Metropolitan looks forward to be a part of that discussion. But it's important that we coordinate, that there be stronger coordination amongst HHC, Metropolitan, and other city agencies as we work to address the street homelessness issue that we have from East 96th Street to East 110th Street. As a lifelong resident of East Harlem, I can tell the significant increase with street homelessness, obviously because of the pandemic and other challenges. So we just look forward to seeing how the city is able to provide more robust and adequate mental health services in hopes that we're able to assist these homeless citizens in our community.
Are you finished, Mr. Smith?
Oh, yeah, that's it. Thank you.
Okay, thank you very much. Let me ask you, since this has been an issue for quite a while, about the outreach centers, have you been in touch with your local council members concerning this issue, and have they been able to help you in any way?
You mean the outreach in terms of the homelessness issue?
Well, the homeless and also the drug treatment centers that you referred to.
Oh,
Because I know
yes, yes, yes,
Councilmember
yes.
Ayala represents East Harlem and she goes into the South Bronx. But I'm not sure whether you have somebody from the east side, south of her, who's also part of your district.
Well, to answer your first question, in terms of liaising with Councilmember Ayala, we have not had a discussion with her in regards to that particular issue, but we recently. But we do intend to rev that effort back up. There are a lot of other community partners and groups that are actively engaging those issues, so we'll probably be incorporating ourselves into those conversations. But to answer your question, we will intend to work with Councilmember Ayala's office as well as other local state elected officials to see how we could formulate some type of plan to work to further address these challenges that we face in the East Harlem community.
And as you know, Mr. Smith, you have a new borough president, Councilmember Levine. So that becomes another base to touch to make sure that he fully understands the needs that you have in and around Metropolitan, which obviously are needs in the greater East Harlem area.
Absolutely, and thank you so much for that, recommendation, and we'll make sure that we put that on. I mean, obviously, it's on top of all of our minds to liaise with our borough presidents, but we'll make sure that we touch base with them this week to get those initiate those conversations.
You stated that Metropolitan needs a new emergency room in order to meet the needs of the growing East Harlem community. Do you know whether any of that request has been funded yet by the city?
Not that I'm aware of. I think there've been conversations about potential councilmanic funding, capital fund that could be potentially available, but there have not been a tangible a solution in terms of the funding source for the emergency room.
Well, I'm sure that your CEO, Christina Contreras, who formerly was at North Central Bronx, who has an excellent reputation at tapping into borough president funding and city council funding, is already on that job, if this has not yet been funded. So you should speak with her. Finally, the issue of parking in and around the hospital is a citywide problem. I live 2 blocks from Jacoby Hospital. It is a problem in and around our area, yet people need to park someplace. So I know that's an issue, and maybe DOT can do something for you there, but you also need to sit down with Ms. Contreras and see what could possibly be done either within the hospital or adjacent to it. But that I think you're already doing.
Yes, we just wanted to make sure, for one, we just wanted to make sure that we highlighted, Ms. Contreras has had the conversation in regards to the emergency room, and we did discuss briefly the parking challenges. We just wanted to make sure that we made it as part of our formal submission. That way it's highlighted, and we also can use this as part of our efforts to lobby, not lobby, but, advocate for additional expanded funding.
Thank you so much, Mr. Smith. Thank you for your presentation, and thank you for the follow-up on the questions. Are there any other questions from
Bob, yeah, I just had a question.
Sally? Go ahead.
I wasn't exactly clear. Is your LGBTQ center now fully open?
No, it's still under construction.
And when do you expect, it's been under construction for a while now. When do you expect it will be completed?
I have not gotten a status update on that, but I'd be more than happy to, once I do get that update, to forward that to you.
Yeah, it's such an urgently needed service. Yeah.
Absolutely, especially when especially with what may be perceived as high concentrations of that particular community, especially in Manhattan and northern Manhattan. So yes, I agree with you. It's important that we that effort is accelerating. We're able to have that launch. So hopefully we're able to get that done soon. And Metropolitan looks forward to welcoming all of you, at that ceremony.
Thank you.
Are there any other questions from any board members? Hearing none, thank you again, Mr. Smith, and please give our wish for happy Thanksgiving to all the members of the board there at Metropolitan. Is there any old business? Is there any new business? Hearing none, and I'll call a motion to adjourn this meeting. Thank you for your support. Please stay safe and be well, everybody.
Thank you. Bye, everybody.
Bye, everybody.
Good evening. Bye-bye.
Happy Thanksgiving all. Happy Thanksgiving.
Thank you.
Happy Thanksgiving.
Well done, Bob, and with 20 minutes to spare.
Really?